Are you suffering from short cervix? Did your doctor mention that you need a cervical encirclage, also known as cervical stitches? Are you worried about what is this cervical stitches, when should I have it, and what is the aftercare that I should follow? Relax. Let me cover all these for you in this video. Hi, this is Dr. Abinaya Vijayakumar. I am a doctor and a post-pregnancy coach. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy, confident and positive throughout their pregnancy and to connect with the child in the womb using simplified Garbh Sanskar technique. To know more about the courses, message me on Instagram or email me. I'll provide the links in the description, and also I will give the link towards the Tag Mango course of post-pregnancy pre-recorded videos where you could sign up and start watching the video straight away. With no further delay, let's get started. Before we move ahead and know about the cervical stitches, let us know a little about what is cervix. Uterus is more like a funnel-like structure where the narrow part is something similar to that of the cervix. The cervix has two areas, which is external os and the internal os. I'll put a reference image over here so that you understand what I'm talking about. So the distance between the external os and the internal os, this is called the cervix length. The usual length of the cervix is between 3 and 4.5 centimeters. So anything above 3 centimeters is completely normal. But if the cervical length is less than 3, we need to have a watch on the cervix length in the upcoming scans as well, because as pregnancy advances, this is more like blowing up a balloon. While the balloon is without air, we have a small conical shape with a narrow end. But as the balloon expands with air inside, the body gets bigger and bigger while the funnel-like part gets shortened and just becomes like a rim. This is more similar to that of the pregnant uterus. So as pregnancy advances, there is always a chance that cervix length can shorten up. So during the follow-up scans, if the cervix length is 2.5 or less than 2.5 centimeters, then the pregnant women would need cervical stitches. That is nothing but stitching the mouth of the uterus. We just put a tight string suture around the mouth of the uterus, that is the cervical region, such that it holds tight and closed without opening up. Because as pregnancy advances, when the length decreases, there is always a chance that the cervix might not be able to hold the weight of the baby and can open up anytime during the later pregnancy. So this stitching in the cervical region to hold the cervix closed throughout the pregnancy, such that the pregnancy can proceed into a term pregnancy and the baby would be born as a fully grown mature term baby. What are the indications for cervical encirclage? As I've mentioned earlier, the prime indication is the cervix length. If the cervix length is somewhere less than 2.5 centimeter or extremely short, like less than 2 centimeter, then it's an absolute indication that she has to undergo cervical stitches. What are the other indications for which cervical stitches would be advised? If the pregnant women had history of previous miscarriages, especially around 20 weeks or 22 weeks, that is in the mid-pregnancy, then she would be advised to have a prophylactic cervical stitches. The other reasons can be precious pregnancy, conceived after 5 years or 10 years of marriage, or conceived after fertility treatments like IUI or IVF. In all these conditions, the gynecologist might advise cervical stitches. So how is this cervical stitches done? Nowadays, cervical stitches, also known as cervical encirclage, is done as an outpatient procedure where the women would be advised to get admitted in the morning after all the pre-op investigations. The procedure would be somewhere around 30 to 45 minutes, and once the procedure is over, she would be in observation for another 2 hours, after which she can be very well discharged. But there are certain aftercare precautions that the women need to follow after the cervical stitches are done. First, if the cervical stitches are done just as a prophylactic, that is for a safety purpose in order to prevent any miscarriage, when the woman has previous history of miscarriage or the cervix length is borderline, then the pregnant women might be advised by her gynecologist to do normal simple day-to-day activities within the home, but to avoid lifting any heavy objects, stair climbing, sitting on the floor, or avoid sexual intimacy as a general precaution. But if the cervical stitches are done after repeated miscarriages, or if the pregnancy is very precious or conceived after 5 years, 10 years of marriage, or after IUI or IVF treatment, and the cervix length is extremely short, somewhere around 2 centimeters, then the pregnant women might be advised strict bed rest, where she will be allowed to get up only while having a food or using the restroom, but rest of the time she would be advised strict complete bed rest. When is the cervical stitches done? Usually it is done around 14 to 16 weeks. But if the cervical length is found to be short around 20 weeks or 22 weeks, even then cervical stitches can be done. In prophylactic cases, the cervical sutures can be advised somewhere around 12 weeks itself in order to prevent complications like miscarriage. When is the cervical sutures removed? When the pregnancy advances into full term pregnancy, that is 37 completed weeks, usually the cervical stitches would be removed, because after 37 weeks, even if the cervix opens up, the baby is going to be a full term baby and it is fit to survive. So opening the cervical stitches is also a simple procedure which can be very well done by your gynecologist within few minutes. Usually the women might be advised to stay in hospital itself if it is somewhere around 38 or 39 weeks, because as and when the stitches are removed, the women can go into labor anytime. Post procedure, you can feel mild soreness or pain, which is very well tolerable and not very excruciating. I hope you found this video useful. Do take few seconds to subscribe to my channel, because your small action can motivate me to do regular informative videos on pregnancy and motherhood. And also share this video with another pregnant woman who is worried about her short cervix or who is being advised to undergo cervical sutures, such that she know all about how she can prepare herself for the cervical stitches. Don't forget to comment your doubts about the cervical stitches in the comment section. Until I meet you in the next video, stay happy, stay mommified.